Good afternoon, Victoria, and thank you for tuning in today. Today is a brief update to continue keeping our Victoria residents informed. We've lately received a lot of questions about our local occupancy compliance task force, so we will address that effort in just a few minutes. To start, we'll hear a standard public health report from Victoria County Public Health Director David Gonzales and our Public Health Authority Dr. John McNeill, followed by Fire Marshal Tom Legler to address that 50% occupancy limit put in place by the governor. And then we will take some questions. A few reminders before we begin. Our hotline hours of operation changed August 27th to Monday through Friday, 1 to 5 p.m. The second update I wanted to remind everyone is election season is upon us, so please register to vote. You can do so by mail or in person. You can visit vctxelections.org. Again, that's vctxelections.org. And you can submit an application to mail or register in person at 2805 North Navarro. Again, the deadline to register to vote in this year's election is October 5th. Now, with our public health update, will be David Gonzales. I'll turn it over to you. If you want.
Good afternoon. First of all, I want to commend Victoria County residents on their strict adherence to the guidelines and recommendations that were put in place a few months ago. With the strict adherence and to the guidance and the guidelines that we've issued, we've managed to keep our daily case counts very low over the past month here in Victoria County. At this point, I'd be confident in saying the level of transmission has dropped here in Victoria County from significant now to a moderate level of transmission of COVID-19. On average, we've managed to reduce our 7-day moving average of cases from a high of 102 a day on July 20th to now a current day average of 12 as of this Saturday, the 29th. While all this is great news, we still encourage citizens to proceed with caution as we have kids returning back to school. We have social activities increasing, extracurricular activities increasing, as well as some bars and other establishments open back up that encourage close social gatherings. As for case investigations, the Victoria County Public Health Department EPI team has now managed to get caught up on investigations. Typically, upon receiving positive lab cases and results, we're able to complete those investigations within 1 day, with about a 2 to 3 day average of delay on receiving those lab results from the patients themselves. Now, a quick update on vaccines. As of yesterday, we received information from Dr. Scott Gottlieb, who is the former FDA commissioner. It looks like the FDA may go on to approve vaccines for select groups as early as the end of this year. But for vaccines for the general public, it looks like it may be a little later than that, possibly into next year. And with that, that's all I had. And I'd like to turn over now to Dr. McNeill to give an update.
Good afternoon, and thank you. You know, I've been looking forward to coming to a press conference where I really didn't have too much to say, and that's today. Anyway, there are just a few things I want to stress that, nationwide our cases are down, and Victoria mirrors that. Remember one time, about a month ago, Victoria was one of the worst places in the nation for COVID. So I have to tell you, just like David said, the people of Victoria have done a good job. Everywhere I go, I see masks. I see everybody in masks, and I have to think that it's not just a mandate causing that. I have to think that we're finally doing what we need to do to slow this virus. That being said, we need to remember that this virus has slowed, and we've taken our case counts down, and we've taken down our 7-day average, and we've also changed our transmission in the public to a lesser degree. So it's all working, but that's the thing. It's working because of what we're doing. We can't drop our guard. We dropped our guard before, and the cases went up. So let's not let that happen. Wear your masks, social distancing. I read a thing from the CDC earlier this afternoon. The CDC actually complimented Texas as one of the examples of how to turn a dreadful situation around. Our numbers have dropped significantly, and we're doing a lot better. But that's because we've done the work. We're wearing the masks. We're avoiding social gatherings. That was the one thing that are starting to pick up, that we're starting to see, and they're starting to see this nationwide, and we're starting to see it in Texas, is that a lot of people are starting to go to social gatherings and go to places where they socialize closely with people they don't know. I'm telling you folks, that's still dangerous. There's still COVID out there. You've got to be careful. I can tell you there's a lot less of it out there than there was. Working in the emergency department before, it was all day long, every day. Now the cases are sporadic. The number of deaths have dropped. The number of patients in the ICU have dropped. Although we still have a lot of patients in the hospital, and we still have patients that are in very critical condition. But remember, it's the new cases we're looking at, because eventually the other cases will work themselves out. So anyway, the last thing I want to mention is that we are coming up on flu season, and I'll tell you that we're already starting to see flu. And that's a little worrisome because that's early. Typically we don't see flu in August and September as much, but especially in late August. But we're already diagnosing cases of flu. And we just kind of started checking them because these patients were coming in and they looked like they had COVID, and they were COVID negative. So we would retest them, and they're still COVID negative. So then we do a flu swab, and they have the flu. So, and that's what I was talking about the last time we met, was that we're going to see cases like this, and we're going to see patients that are sick, and we don't know exactly what it is. So flu is out there, and the best way to fight that, without a doubt, is get a flu shot. If you've never had a flu shot before in your life, I'm not sure why you wouldn't, but if you've never done it, please consider to do it this year. Remember that the national average is about 45% of the nation gets flu shots on a given year. The CDC's goal this year is 60 to 65%. We would like to get a lot more people vaccinated because that will decrease the amount of illness in our community, and it will decrease the amount of illness that confuses us as far as, is it COVID or is it flu? It also frees up more space in the hospital for COVID patients that we probably will start to see again. Okay, so I'll be available for questions in just a few minutes. I want to compliment everybody that's up here, because everybody's done a really wonderful job in that, and I want to compliment the City of Victoria and the residents of Victoria for doing a great job as well. Okay. Thank you. Oh, and Tom Legler is next. Yeah.
Good afternoon, and thank you. The Business Task Force for COVID-19 Education has been proactively out in the community since the orders came into place. And our goal is to educate local businesses, including restaurants, about the 50% occupancy limit. The task force has been actively inspecting all local restaurants and most other businesses as we can, including following up on complaints. At this time, we have not seen any violations of the 50% occupancy limit. We continue to encourage businesses and members of the public to remain compliant in maintaining proper social distancing and wearing masks inside the business or the facility. The task force continues to monitor and help educate businesses during this time. We thank them for the work they are doing to help educate our business. The Victoria Fire Marshal's Office continues to monitor local businesses and their response to COVID-19 requirements set forth by the governor. In addition to traditional restaurants, TABC has issued guidance for bars to change their business model to become restaurants. While the Fire Marshal's Office does not enforce TABC rules, including percentage of food and alcohol sales, we are working with the new restaurants to comply with occupant load requirements. We have often heard from concerned citizens that different restaurants are overcrowded based on their overflowing parking lots. A lot of the restaurants do not have enough parking spaces for all their seats, so they overflow into neighboring businesses and the street. The occupant loads established by the Victoria Fire Department, for those that don't know, the government orders allows restaurants to operate at 50% of their capacity, but employees and contractors don't count. Normally on a 100% capacity that the City of Victoria issues for an occupant load, it includes contractors, it includes employees. The 50% mandate from the governor does not include those employees. So there's always that difference. There's always that challenge in that you may have an additional number of cars over the 50% or additional people over the 50% that are based on employees. Last, I'd like to clarify that there remain signs posted at local businesses that say measures were put in place due to a local order. Those signs are no longer accurate and should be considered outdated. The sign should now read, "These measures were put in place due to the state order because the mandate is acted by the governor's office and not locally." We encourage businesses to contact the Fire Marshal's Office with any questions at 361-485-3460 or by email at fmo@victoriatx.gov. Again, I want to thank the businesses and the public for maintaining their vigilance, and at this time would open up for any questions.
Chief Legler, just two quick ones to start. Just to confirm, a true bar that only sells alcohol cannot currently operate.
That is correct.
Okay. And then in terms of the task force generally, are you operating primarily in response to complaints, or are you proactively, patrolling, or how does the task force work?
We do both. We have been proactively enforcing it and monitoring the local businesses beyond just business hours, but after hours as well on the weekends. So we have a good feel of where we are, but we also respond to complaints as well.
Okay, so you said businesses need to change their signs. How long do they have to mandate that order, change their signs?
It's not so much as a mandate, but we would just like to update people with the latest information, and we have those signs so the business can reach out and we can provide those signs for them. It's just trying to update and clarify the language that's on the signs.
And they reach out to you guys?
Yes.
Either Dr. McNeill or David or Chief Legler, if you'd like, could you just walk folks through what they should do, prepare for Labor Day weekend, to make sure they're just being safe, and kind of what activities they should be avoiding?
Honestly, they say look back at history if you want to see what can happen. Well, you need to look back at the bumps that we've had after every holiday, okay? And that's because people don't social distance and they don't wear masks. So what I would tell people is avoid crowds. You can't go to the beach when there's 20,000 people on the beach. You can't go to a bar when the bar is so stuffed you can't even stand up in there. Now that's fine if they're under their occupancy numbers, but if you have 300 people in a building and 150 of them are squared or crammed into an area right in front of the bar, that's not social distance. And we've all seen that, and we know that happens. Right? See, I'm not just making it up, but that's what I'm saying. So you've just got to be vigilant. When I go places, now, wearing this, it's just, you get out of the car and you don't have it on, you feel like you need to have something on. You feel like you forgot your shoes or something. So wear your mask, no matter what you do. And avoid family get-togethers, I could just go on for an hour and tell you horror stories about people that had family get-togethers, and the next get-together they went to was a funeral. So it does happen. You've got to be careful with that. So let's see if we can do better on this holiday. And you know what? It's not for the rest of our lives. We're just talking about one holiday, one big party. Save the rest of your life and have the big parties later when we don't have as much COVID around as we do. The numbers are down, but they can go back up, and that's what we don't want to see happen.
Ideally, would you encourage folks to socialize outside? Is that preferable, and could you explain why?
Well, the CDC is very clear on that things outside. But then again, some establishments have taken that to mean we can put 200 people on a patio that's no bigger than this room, and that's not the case. So being outside, of course, we know how this disease is transmitted, and we've said it over and over through droplet therapy. Air comes out. If you're out in the breeze and it's warm and it's blowing air, then the chance of that virus getting toward you is less. But it's best if the person with the virus has a mask on, the person without the virus has a mask on. So that's the best thing. But outside, yes, is statistically safer. The majority of this disease is transmitted in the home. But that's the problem. You get it outside, you come home, you give it to your family. Okay.
And just as we get ready, to start, if the ISD is starting resuming in-person classes on Tuesday, can you, I know we've talked about this before, but David or Dr. McNeill, can you talk us through kind of how an infection in the classroom will be handled?
David, you'd probably be better.
Yeah. Sure, it'll be handled very similarly to just any other infection we have in the general public. We're already in constant communication with the school districts here to make sure that they're well aware of the reporting requirements and recommendations, as well as how they can handle those that contact tracing within the school in those case investigations as well. We're here to assist any of the school districts here on anything they can do. I know we've had a few calls already with several just to kind of offer guidance. So we're going to do what we can to minimize spread both in the classroom as well as outside. So the health department will handle more of the the settings in the household and out in public and the contacts there. And then the school district, the school nurse and staff there, administrative staff will handle more of the internal investigations because they know those students. They know where those students are on a daily basis. If they're in one classroom, they're moving to several classrooms, so they can really do the best they can on minimize transmission.
Obviously, this will vary, on a case-by-case basis, but if there is a kid or a teacher who has an infection, should everyone else in that classroom get tested, or kind of how will testing recommendations evolve?
Yeah, it's a good question. So one thing we're really looking out for is the type of exposure, like we've talked about in the past, what level that is, if it's a low risk or medium risk or high risk exposure. But that'll be a lot on the investigation itself, if both wearing masks, if they're a distance, if the kids in the classroom, if there's 10 kids versus 30, whatever that scenario is, and if they're wearing masks that whole time during the interactions. There's a lot of factors that play into it, so it's hard to answer that question specifically. But we'll definitely encourage trying to get as much information as we can from that staff to really evaluate on a case-by-case basis, which is what our plans are to do.
How are you guys making sure that all schools have the supplies they need to keep the COVID out of the schools?
Yeah, it's a good question. I know the schools, Region 3, I think, was working with the Texas Division of Emergency Management to get a lot of PPE in schools, and I think they've done a great job of that. I'd heard a few school districts that had some shortfalls on their supplies they're getting in, but I think that's been addressed since then. I know when the governor was here a few weeks ago, Chief Nimkid with TDM had addressed that directly, and I think they were able to satisfy those. They can absolutely reach out to us. They can reach out to the Office of Emergency Management here, and then we can help them coordinate any of those PPE needs. All right.
Okay. If there's no other questions, I want to thank you all for your time, for tuning in. Thank you, media, for always being present and helping us get good, accurate information out to the public. Again, recapping those reminders that I mentioned at the top of today's briefing were, hotline hours of operation have now changed. It's Monday through Friday, 1 to 5 p.m. in the afternoon. And then the second update was to register to vote online, visit www.vctxelections.org. To register to vote in person, you can visit 2805 North Navarro. And again, that deadline to register to vote in this year's election is October 5th. For more information, call our hotline at 361-580-5796 or visit victoriatxoem.org. Thanks again and have a great day.